In the last 24 hours, we identified 194 new cases and completed about 7,100 tests. Our positivity rate was about 2.9%. Currently, 84 people are being treated for COVID-19 in hospital, including 18 admitted to the ICU. Cases have risen recently, almost entirely in those who have not been fully vaccinated, as we expected would likely happen as people come in close contact with each other again. Similar trends are being seen in other provinces that have lifted restrictions. I am pleased that overall hospitalizations continue to decline, and we will keep watching these closely. As I've said before, vaccines dramatically reduce the risk of severe outcomes and the risk of infection. For example, since July 1st, people who were not fully immunized made up 95% of all cases of COVID-19, 94% of all those who have needed hospital care for COVID-19, and 95% of all COVID deaths. Having 2 doses of vaccine has never been more important. The Delta variant spreads more easily, and that second dose is critical for protection. That's why it's good news that more than 64% of eligible Albertans are now fully immunized, and 75% have had at least 1 dose of vaccine. We still need to increase those numbers, but this is encouraging progress. With so many people protected by vaccines and doses available right now for anyone 12 and over, the threat of this still dangerous virus is shifting. While COVID-19 cases may rise in the coming weeks and months, a surge of hospitalizations and other severe outcomes is much less likely thanks to vaccines. I know that the rise in cases over the last week has created some anxiety in some people. After all, we have been closely watching case counts for well over a year. When we heard of COVID-19 first, we knew little of the virus and we had no treatments and no vaccines. This meant we needed to enact unprecedented measures to protect human life and to prevent our healthcare systems from being overwhelmed. We have made incredible sacrifices, staying away from loved ones, closing the doors of our businesses, and canceling important events, all to protect one another. These sacrifices were necessary at that time. Today, we are in a very different place. Vaccines are able to drastically reduce the risk of not only contracting the virus, but more importantly, getting severely ill. From a public health standpoint, this has changed how we need to look at the virus. As we have always done, we need to weigh the direct impacts of COVID-19 against the indirect impacts that come from our interventions, especially on children and other vulnerable groups. With a vaccine readily available, the need for the types of extraordinary restrictions we used in the past has diminished. At the same time, we must also start preparing for other health challenges. Last year, we saw an extraordinary decline in other respiratory viruses. In fact, there was not a single case of seasonal influenza identified. We expect that to change soon. With the unprecedented public health measures used over the last year no longer in place, we will likely see higher levels of other respiratory viruses like influenza starting late this summer and into the fall. Vaccines for some viruses like influenza are available, but this will mean more patients needing testing for clinical reasons and in some cases medical care. We need to make sure that Alberta's health system is able to support all patients. That is why we are making changes to bring COVID-19 measures in line with how we handle other respiratory viruses, while keeping strong measures in place to protect Albertans. After the past 17 months of restrictions, I know this will likely feel like a dramatic shift for many. We have grown accustomed to protective measures, so some anxiety is only natural. I want to assure Albertans that some things will not change, not tomorrow and not any time this year. We will continue to respond to COVID-19 in keeping key measures in place to protect everyone, including having vaccine appointments widely available, testing symptomatic Albertans for whom this information will change their treatment, and preventing and managing outbreaks in high-risk locations like continuing care. However, we will start to change several other things gradually while keeping a close eye on hospitalizations in Alberta. The first changes will happen tomorrow and are relatively small. As of tomorrow, quarantine will no longer be universally legally required for close contacts of confirmed cases, although it could still be required in some high-risk settings or for outbreak management. We are still recommending that close contacts who are not fully immunized avoid public places for 14 days, and we still have mandatory isolation for both positive cases and symptomatic people. Anyone who knows they have been exposed to COVID-19 should monitor for symptoms and should seek testing if they become symptomatic. We will be stopping routine asymptomatic testing for close contacts. This will help reduce wait times and ensure timely results in the coming months. But to be clear, anyone experiencing symptoms should still isolate from others and will be able to get tested province-wide. As quarantine is no longer required, contact tracers will no longer call close contacts. We recommend that where it is possible to do so, positive cases can notify their close contacts. Public health will start focusing on identifying and managing outbreaks only in high-risk locations, such as continuing and acute care and high-risk workplaces. We will keep watching COVID-19 closely and will take whatever actions are needed to manage any high-risk outbreaks or severe cases, as we do with any communicable disease. Over the next 2 weeks, we will closely monitor these changes and adapt as needed to give more time to vaccinate Albertans before the remaining changes begin on August 16th. What we know from looking around the world is that COVID-19 will not be eliminated. We will be needing to live with this virus for years to come. And so what we need to decide as we look at the impacts of public health interventions, the choices about using a large amount of resources to focus on a single disease when there are many others that also cause illness and problems, and again, weighing the direct impacts of COVID-19 infection, is to make the determination about how we best utilize our public health resources and the human resources we have to provide the most benefit for the most people. We know that vaccines are highly effective, they are widely available, and I strongly encourage Albertans to access that protection against things like long COVID or other outcomes that can be life-altering. However, from a provincial perspective, as we look at, again, those public health markers of when it's appropriate to make shifts in our policy, we need to be thinking not just about COVID specifically, but again about all of the other issues that we need to be managing and dealing with. And we need to be ready to manage an increase in many respiratory viruses this fall. So again, this is about making sure people know they have that opportunity to be protected, and yet looking at the system as we look at that big picture of when we make that shift to managing COVID-19 as one of many infections and not the only infection that we're focused on. When we have an event, and certainly an event of interest like the Stampede, the data is not static. Of course, we continue to monitor, and so the data that was provided with 71 cases was current as of that date. But we do continue to monitor new cases as they come in. There is continuing to be case investigation, and as of yesterday, there was an increase. So at this point in time, there have been 84 cases that have been identified as having most likely been acquired at the Stampede out of more than 500,000 attendees. So again, important to remember the denominator as well as the number of cases. And just want to take you through a bit of that process, because when we get a case, part of the case investigation is finding out where that individual was when they were infectious, when they could have passed it to others, and where they were in the 14 days before they got sick, so where they might have acquired it. So when cases are identified that were at the stampede in either of those periods, they're flagged for some additional investigation. And at that point in time, our investigators determine where is the most likely place that they acquired it, because we know that some people who attended the stampede also might have attended a house party, or they might have been to another location, they might have acquired it from someone at home. So just because they were at the stampede in that 14-day period doesn't mean they acquired it there. So that 84 is the number that, after all of that assessment, it's been deemed as the most likely location of acquisition. And again, just thinking through the volume of people who were there and the protective measures in place, we did know there would be some transmission events. We will continue to monitor, and so that number will likely change over the coming days. However, we're sitting certainly a few weeks past the onset of stampede, so anticipate the number of new cases that we add will decrease over time. And again, want to emphasize that what matters right now, cases are less important, and hospitalizations and severe outcomes are really the critical indicator that we are moving towards watching.